Professional athletes are prone to patellofemoral pain syndrome, which usually refers to pain under and around the kneecap. The pain due to this injury can often cause professional athletes to watch from the sidelines as their body properly heals. Today, we visit with Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about patellofemoral pain syndrome.
Patellofemoral pain syndrome is a pain syndrome involving the front of the knee or the structures around the kneecap. It is actually a group of different diagnoses put together that are sometimes difficult to separate out. Most of the time, athletes that have patellofemoral pain syndrome have some issue with respect to strength of the quadriceps, their core muscles, their stance muscles, and on occasion individuals will have problems with alignment of their limb or where the position of the kneecap is. The symptoms are typically pain just around the front of the knee. Treatment for patellofemoral pain syndrome is primarily strengthening of the quadriceps and the core muscles. It can be supplemented by orthotics or bracing that help alignment issues. Sometimes anti-inflammatory medications or cortisone injections like steroid injections can be helpful to manage symptoms. The athlete with patellofemoral pain syndrome can typically play given their symptoms are reasonably well controlled.
It's been pretty clear that strength training to the hip and the trunk, finding a better alignment of the whole lower limb via this strength training and stretching the certain muscle groups, and then also possibly using orthotics in the shoes, have been very successful in relieving the symptoms with these patients. So the rehab process could take a good 6 to 8 weeks if we're strength training. If it's purely because of foot mechanics and you make a biomechanical orthotic for the shoe, that could really get rid of the pain in literally days. So it kind of varies as to what the cause of the problem might be.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.